Welcome to the One Dream podcast. Today we are joined by Paul Renner. He is a former Speaker of the House for Florida, a veteran, a constitutional conservative, and someone that we at Stand for Health Freedom are supporting for Florida's next governor. So thank you so much, Mr. Renner, for joining me today.
Great to be with you.
Paul, you've had quite the remarkable career. And so I would just love to hear from you. You have served in the military before entering public office. And how did that prepare you for what it means to commit to public service?
Well, in two different ways. One is it's a lot of training of leadership under pressure. I've had a lifetime of positions of trust in the military, leadership under pressure, obviously during two wartime conflicts, leading a group of men, in the first one in 1991 in Desert Storm, and 20 years later in Afghanistan, a group of men and women as an intelligence officer, keeping foreign fighters from killing Americans in Afghanistan. And so that leadership under pressure then was even built upon when I was a prosecutor prosecuting habitual and violent habitual offenders. So I know what it's like to be under the hot lights, or in the crucible, if you will, and to stand strong for principles, to act with courage and conviction. And so that's what I'll do as governor. That's what I did as Speaker of the House. And you've got to have somebody who's willing to lean in and fight, and not just take no for an answer to get big things done that we need to have done.
Well, one of the big things that we saw you do was lead as Speaker of the House in the state of Florida. And at that time, Stand for Health Freedom was supporting the Parental Bill of Rights every step of the way. So you strongly supported that, is my understanding also. And why was that particular bill so important to you as Speaker of the House?
Well, if we believe in freedom and we believe in kind of the traditional way that family was the first form of government, Aristotle said that. That predates Christianity and Western civilization, really going back to the very beginning of Western civilization, that family is the first form of government. And we have to have strong families. And that means mom and dad get to make informed decisions about their children's mental health, physical health. These decisions about where they go to school are very, very important. And I was proud as Speaker to pass universal school choice, to stand for health freedom when it comes to parental rights in all aspects. There's more work to be done. And if you want to get the new challenges solved, you go to someone who solved the challenges of yesterday, and that's me in this race.
Some people still say that parental rights are under attack in a big way in Florida. And I don't know where you stand on that. Are you still seeing issues that you want to see fixed today? Or do you think that everything's going well with as it relates to parental rights?
Well, it's going better since some of the passage of our legislation. But look, there's a mindset that we know best for you better than parents, and we're going to make the decisions and not inform you of what those decisions are. And we put an end to that legally in many avenues, but not all avenues. And I know, one of my supporters is working very hard this session, or has been working very hard to pass legislation to protect parents and make sure that they're advised and involved in the mental health of their students that is happening in school clinics, where people just, I don't know if it's their upbringing or their education, that they know best and better than a parent, and shouldn't include the parent in something very material in the life of their child, their son or their daughter. And that's just not right. I believe parents should have the primary role always in the decisions about their children, short of abuse and neglect and things of that nature, obviously. But most parents are good parents. They know their children better than anybody else, and they need to be involved in what's going on with their children's lives, not somebody who thinks they know best for them.
Yeah, I've heard that, one of the agenda items right now in Florida was to make certain that AI isn't being used irresponsibly within schools, because that also takes parents out of the equation with what our kids are exposed to, what kind of assessments are being done on them, what kind of curriculum are being funneled into. Do you have an opinion about the AI in schools?
I do, and I've already come out in our Health Freedom and Wellness Initiative, which is on voterenner.com. You can see all of it. Is that I want to make sure there's an opt-in for parents. I don't want any data collected, and we passed major data privacy legislation when I was Speaker. So your adults and everyone's information, personal information, is not being sold or shared without your knowledge or consent. We don't want them gathering data on our children that they can monetize. We don't want that AI going home with them. And we want to make sure that AI never becomes a substitute mom or dad, a boyfriend or girlfriend, a god or an oracle to your child, because it really is a soulless algorithm. And we've seen children that have taken their own lives, that have been taken to a dark place by an algorithm that simply does not have any kind of moral compass.
Hmm. Yeah, and hearing you speak so clearly about these issues, it's a reminder that Florida has tackled a lot of big issues. You've tackled keeping data centers out. The state has tackled medical mandates from certain angles, fluoride in the water, geoengineering. Those are all huge issues, and all eyes are on Florida as a beacon of freedom. Why do you think it became that way? Like, what's going on? What put Florida in this position to be the trailblazer?
Well, I think we made a different choice during COVID, and in my own experience with respect to health freedom, it really happened there. I mean, I was, military guy, just give me shots and, do whatever. I just assume everybody's, doing the right thing. And COVID was a wake-up call. And the other big wake-up call for me was working on legislation to stop children from being able to access at a young age addictive social media platforms, platforms that use addiction as a business model to hack the human brain and keep children on 6, 8 hours a day, despite knowing that it causes them significant psychological harm. And once I saw that, a lot of other things make sense when it comes to drugging patients and basically keeping people on pharmaceuticals for a lifetime, whether that's good for them or not, and realizing that too often people are motivated by profit and not by what's right for their customers. And that's very unfortunate, but we have to be on guard and look at just telling the truth, giving people full information so that they can make decisions that are best for their health.
I think too often when you're put in a position such as governor, there's such a pressure to say progress and commerce are our number one priorities. And when we prioritize progress and commerce over how a policy or an agenda affects a community, we find ourselves in a bad way. I mean, the way that we have just allowed progress to run over family values has put us in a position where I think that a lot of people are ready to see a cultural shift.
Amen to that. I mean, and again, social media, there's nothing here to see. We just got to keep it unregulated. They're still saying it's not addictive. And now what we see with respect to AI data centers is there's nothing here to see. It's all going to be fine. But we know that it raises electric rates and people cannot afford any more price increases right now. And then the damage to our environment with the massive water use here in Florida. Think of a giant, huge straw going into the aquifer that's already stressed, depriving us from clean drinking water, irrigation water, and the like. And so I've just said for those data centers, they need to bring their own electric and their own water supply. And when it comes to geoengineering, you mentioned earlier, we've got to stop that and really enforce that. That means taking money away from airports that are allowing those flights to take off. We will not let them poison our skies, poison our waters. We have to make sure that the quality of life here in Florida is what it's always been. And that starts with great environmental policy that protects our water, protects our air. And I believe in that. I was a champion for the Florida Wildlife Corridor to make sure that we're not paving over all of Florida. And we do this the right way. We are going to develop, we're going to grow. AI, I can't stop AI. I get all that, but we have to be very careful that we don't destroy our quality of life and just run roughshod, as you said, without any consideration of possible objections and possible problems that could arise. We did this with social media, and now a generation later, we're seeing kids' lives have been wrecked by it. And only now are we starting to regulate it as we should have done at the outset.
Absolutely. These kids have been an experimental population when it comes to technology. And I don't know what we're going to see in the future, but one thing I've heard you talk about over and over again is bringing healthcare back to the state, back to Florida. What does that actually mean? And what would that look like for the average Florida family?
Well, look, I'd like to see the repeal of Obamacare because the fact that we have to subsidize hundreds of billions of dollars means it's not working. And my wife and I just bought an oven and a microwave set, and it's got all these fancy features that we'll probably never use, but we paid for them. And that's Obamacare. It really over-regulates healthcare in a way that drives up costs unnecessarily. And I'm confident if we got control of that back, we would do it better, faster, and cheaper. But more importantly, or equally importantly, is making sure that people have choices, alternative medicine, making sure we're getting true science. And I want to make sure our universities are giving our citizens accurate information about the food we eat and making sure that we go back to the healthy food that we grow right here. Our agriculture sector is one of the best in the country, best in the world. And we have a lot of whole foods that we can deliver to cafeterias, to our schools, to our children, where they can live healthy lives and we as well can live healthy and long lives. Knowing what we're eating, eating great food, and really having wellness at the forefront. And that's what I want to see as governor. I want to make sure people are fully informed about how to live a long and healthy life.
And, as governor, what are the sharpest tools within that to actually reduce Florida's dependency on the federal healthcare structures? Like, what are the two or three levers that could be pulled to do that?
Well, there are gaps in Obamacare. It doesn't cover the whole field. And so, whether it's price transparency, the president talked about that the other night, patient savings, where if you save money in a non-emergency setting, sometimes an MRI, two different MRIs, cost just as much or cost a lot differently depending on where you park your car, literally. And so, making patients or giving patients some value if they go in and save money with the same quality care is a way to try to bring down healthcare cost. But it's more limited. As long as Obamacare is there, it will continue to kind of choke out true innovation, in my opinion. And then it's overcoming, the lobby core and very strong incumbents interest in terms of our healthcare and what is allowed or not allowed here in the state of Florida. But I want to make sure that Florida is a place where people can go to get alternative treatments that are working, that people see work, and allow space for that. And you know what? If you don't want to go that route and you want to go the traditional medicine route or the American medicine route, that's fine. And I'll do that in some cases, but I may also want to pursue alternative medicine. I think that's the right of Floridians. I want to make sure they have full access to a multitude of choices. Obamacare really narrows that down and tells you this is how you're going to get your health care. This is where you're going to get it. This is what you're going to pay. And it really is constraining in that respect. I want to see more patient choice, more patient transparency, which means more information and informed choice in your hands.
One of the things that Obamacare really was stunning with was they developed the quality metrics to grade these doctors for their reimbursements. And the quality metrics, if you look under the hood, is really a lot about patient compliance with standard of care. It's not about patient outcomes. It's not about patient satisfaction, but compliance. And is that something that can be undone at the state level to say those are not the metrics we're going to use when it comes to the health of the mother or the child in front of us?
Well, and you've identified the problem with federal overreach is that if that's how they get paid and you've got to comply and then comply with what? Is it complying with something that works or somebody that, set the rules for compliance and is making money from that, but it's not necessarily the right solution or the right protocol for all people in all circumstances. This is the problem with federal overreach. One size fits all. And if it doesn't work for you, too bad. That's why we don't want to move towards single payer. But Obamacare really is kind of this no man's land of heavy regulation with government that we need to get away from and have it where we can really have, again, a multitude of choice, a lot of transparency, information going to patients, and allowing them to find the health care that best suits their needs.
Why do you think we still call it Obamacare when there's been several administrations or a couple administrations since then? I mean, I guess is that common for the healthcare infrastructure to carry through multiple administrations, or was it just such a huge change that has left a mark on our healthcare in America?
Well, that was his signature initiative, and I think it's more accurate to pin it on him since I don't think it's working than to call it the Affordable Care Act. I call it the Unaffordable Care Act because, again, the old saying from the left is, if it moves, tax it. If it keeps moving, regulate it. And when it stops moving, you subsidize it. And Obamacare has stopped moving, and so they're now subsidizing it. It's not working. And if you had to subsidize something to that extent, it's proof that it's not delivering on the promise of reducing cost. It didn't deliver on the promise of allowing you to keep the doctor you want. Again, it's narrowing those networks and forcing you into a one size fits all program that doesn't allow for innovative treatments. And I was just with a group yesterday that's doing some innovative things in the area of cancer treatment. And I guarantee you there's all kinds of payment roadblocks to something that is working for people, and that should not be. We need to be able to have experimentation, frankly. And if somebody is at the last stages of their life and they want to try something different that's an experimental or natural approach to treatment, they ought to be able to do that. And especially when all the drugs and all the chemotherapy is not working for them, they ought to have that right. And so that's where I stand on health freedom is give people that opportunity. If we see something that's working, then we can study it and continue growing that for others and so that other people can enjoy that benefit. But if we choke that off and we say there's only one way to do this and there's only one way to get paid, you will choke out innovation. And that's what happens as a result of Obamacare.
A couple of things come to mind with that. One is that it might not be a super popular idea, but we have to trust individuals with their own mortality. This human experience, it's human, and mortality is guaranteed, and you have to be trusted with it yourself if we want to live free. And secondly, this Obamacare and the one size fits all is the back door to medical mandates. Because what we're seeing at Stanford Health Freedom is that there is a greater free flow of information right now in the public square. But if a mother chooses to stray from the mainstream recommendation and seek out other options for her child, it's used against her. I mean, it is still a wild pressure to say that there is one way to care for this child and any other way is neglect.
Well, we'll end that when I'm governor. The idea that we're not going to treat your child if you don't get a COVID vaccine for your 2-year-old or what have you is going to end, and we just can't allow that. And the same is true for other treatments. We have to make sure we remove those mandates. A mandate really is a sign that they can't make the case on the cost and benefits. And if you can make the case on cost and benefits, and you believe your product has more benefits than cost, you shouldn't need a mandate. I think that just goes without saying. And remember, the same people that gave you those mandates in Obamacare were the people that gave us the COVID lockdowns, with all the extreme things that happened during that period of time. I look back on it as a moment when we nearly lost our freedoms. I think it was the greatest infringement on civil rights in the history of America at scale, and we can never ever repeat it again. I will not allow that kind of thing to happen as governor of Florida.
It seems that fear is the litmus test for whether or not we'll try to run away with tyrannical measures. And as an elected official, I know that it's enticing to want to solve all the people's problems. But how would you guard against fear driving policies in your administration?
Use the bully pulpit and just tell them don't believe what they're telling you. Exercise your freedom. Let's put all the information out there for you to make educated decisions. Governor DeSantis did that during COVID. I'll do that when I'm governor, and we'll not see a repeat of that if it comes around again. I hope it never does.
What's the legacy that you want to leave for Florida as a governor?
Well, it's just that freedom works. I mean, you see people flooding into Florida. That is a blessing and a curse. But the blessing of it is it's just a testament to the fact that free people, given the choice, we just have Mark Zuckerberg, who's funded a lot of people on the other side of the aisle, is now building a home in Florida because he feels there's greater public safety. He and his family are safer here. They have freedom here. They can prosper here. It's a great quality of life here. And so you see people voting with their feet. California has the greatest outflow of people and money of any state. Florida is the number one state and is bigger than the next 9 out of 10 states combined for inflow. And so it shows you that freedom works. We're going to continue to lean into the free state of Florida. As Speaker of the House, I was an architect of building that. And so I'm going to make sure that we continue down that path and also push back against some of those threats. We talked about AI data centers, and there's others that are a serious threat to our freedoms. And we're going to make sure we continue to follow down the path that has made America such a great place to live, and Florida the best place among the 50 states in America to live.
Absolutely. Well, I want to connect our listeners with your campaign and with what you're doing on the campaign trail in Florida right now. So, how do they follow you and get involved, and where can they learn more?
You can go to voterenner.com, VOTERENNER.com. We would love to have you sign up and volunteer. You can contribute. We are always raising money. We have to raise a lot of money to get our message out. But if we do, what we know at the grassroots level is we are resonating in a phenomenal way. And if we get our message out to the 2 million or so voters in this primary, we will win this race. And we will have a remarkable 8 years ahead of us for health freedom and for freedom writ large.
Well, thank you so much, Mr. Renner, for joining me today. We hope that your message gets out far and wide. Stand for Health Freedom is behind your race to be Florida's next governor. We'll talk soon.
Thank you, Leah. God bless you.